We've got some slides here, but I want to thank everyone, obviously, for logging on and anyone that's not going to be watching this live. We are going to be talking about something super important to not just current practicing dentists, but also dental students and residents that's really potentially going to shape the landscape of dentistry for the years and for the decades to come. On with us today is one of the people behind all of the magic, our very own Mike Graham, who is the Senior Vice President over at the ADA of Governmental and Public Affairs. And if you have been reading any of the ADA position pieces, any of the articles, and frankly, anything really in even the mainstream media, you see Mike being quoted, and we have him here today with us. So thank you for being here with us. This is, of course, as we know, incredibly vital to the future of our profession. And I'm going to let you kind of get started. So tell us why this is important.
Well, thank you. And thanks for taking some time out of your evening to learn more about this issue. You know, I thought COVID was, in my 27 years with the ADA, I thought COVID was probably the biggest issue that the profession faced, really on the edge of a lot of practices going under. And I don't know if you all experienced that, but we all got through it. And I think it was something like 99.5 of all dental practices survived COVID. This Medicare issue is tremendously impactful. And I won't say it rises up to COVID, but it is right here. I mean, it's pretty important. And it is because of how they plan on doing that. So we'll get into that right now. Now, I don't know if you know that much about the Medicare program, and I'll be honest with you, I don't. I mean, I have throughout my 40-some year career working on Capitol Hill. I started in 1979. I like to say that because it makes me seem really old. I mean, the 70s. But I started in 1979, and I really avoided all Medicare issues because it's so incredibly complicated, and I just didn't want to get into that. But I know enough to give you a little bit of a background on Medicare. So there's different parts to Medicare. Part A has to do with hospitals and hospital services and reimbursement. And how is Part A paid for? It's paid for by Medicare payroll taxes. And trust me on this, as boring as this is, it's important to understand it. Part B services are basically physician services. So it was set up for physician practices. And that's how physicians are paid mostly out of Part B. Part C is kind of an interesting part because it has more to do with a program known as Medicare Advantage. What is Medicare Advantage? It's actually a hybrid between traditional Medicare and the private sector. So if any of you belong to HMO plans or PPO plans, Part C allows the Medicare beneficiary, somebody over age 65, to be able to buy into a program that allows them all these bundle of medical services, but then because of the way it's structured, it actually offers different services as well. So they actually, and it's all run through the commercial programs, commercial insurance. And so you can actually get dental care through Medicare Part C or Medicare Advantage. And you can get hearing aids, and you might even get transportation to your doctor. You might even get a gym membership. So they throw in this whole bundle, and it's a way of actually the government saving money, believe it or not, and then offering the Medicare beneficiary more than traditional Medicare. And Part D has to do with drugs. So these are the four main parts of Medicare, and let's go to the next slide and I'll explain why that's important. So what is going on Capitol Hill is they finally said, okay, we want to have a Medicare dental benefit, because if dentistry, if oral health care is essential to overall health, then it seems to make sense that we ought to have a dental benefit, and it does make sense. But how they do it makes a big difference. And so what is being proposed right now on Capitol Hill, it's in the House bill, would do a couple things. Number one, because they're trying to cover all Medicare beneficiaries, that means, anyone over age 65 and above, ranging from those senior citizens who are very poor to the billionaire who might be a Medicare beneficiary. And what they're saying is, we're going to give all of those senior citizens a dental benefit, but we only have this much money. So we're going to create a plan that covers all of them, but it really, to us, it looks more like a discount plan. And I'm calling it that because as soon as, if this were to become law, as soon as that Medicare beneficiary walks into a dental office, they would have to pay a copay. Now, that is not true with commercial dental plans, where usually all the preventative services are 100% paid for by the plan. Under this plan, it's a 20% copay for all preventative and basic services. And then when it's fully phased in, it'll be 50-50, meaning the patient pays 50% and the Medicare system pays the other 50%. And why is that important? Well, right now, we know that of the senior citizen population, that's about 63 million seniors, about 1/3 of those seniors do not go to the dentist because they simply cannot afford it. And under this plan right now, some of those low-income seniors, they won't even be able to afford the 20% copay. If they need a lot of work, and so many low-income seniors do need a lot of dental work, if you're talking about major services like crowns and bridges that would require a 50% copay, that would, let's say it's $3,000 worth of work, that's $1,500. And there's no way that low-income seniors, who often make the decision about paying their rent and what food goes on their table, there's no way they can pay the $1,500. So we have a real problem with the coverage aspect of this Medicare dental benefit. But the other problem that patients will probably never really see is that they want to put this Medicare dental benefit in Part B. Now, if you recall, and can we go back one slide? Part B is, you'll see there, it's the physician services. It was set up for physicians. Well, dental practices are completely different, not completely, they're significantly different than physician practices. And we can go back to that the slide, thanks. And so it's not set up for us. It's the square peg and the round hole. And it would impact the administration, all the coding, the reimbursement, just a whole slew of different things that a dental practice would then have to deal with. So we've got two big problems with the way this bill is structured right now. One is that it doesn't get to those senior citizens that need it most, and that's the low income seniors. And the other thing is that it's administratively it's unworkable. Next slide. And I think I'm going to glance over, just kind of skim over this. This has more to do with how dentists would get paid. We don't know in this bill how you will be reimbursed, because the Secretary of HHS could do it any one of a number of ways. If you look down the right side of this slide, they could index the fees any one of these ways that are bulleted here, and that gives us no comfort in knowing that they're going to reimburse dentists appropriately. And we're concerned that the dentists would be short shrift in the reimbursement, much like they are in Medicaid. Next slide. Okay, so what is the ADA's position? I'm not going to read through this, but this is our policy. And it does two things. And frankly, the two things actually mimic, in a sense, the House bill that I talked about previously. The two major things I've highlighted in red. One is that it would not be a Medicare dental benefit for all seniors. It would only be for poor seniors. and those at 300% of the federal poverty level and below. I should say low income. 300% of the federal poverty level on down. What does that mean? It means that if I were a single senior citizen on Medicare, and my income was $38,000, it'd be up to $38,000 I'd be eligible for this benefit. Now, how many people does that include? Well, actually, it includes 47% of all seniors are at 300% of the federal poverty level on down. So we actually, with our policy, capture nearly half of all the senior citizens, but they're the low income seniors, the ones that need the care the most. And as I said, 33% of seniors do not go to the dentist because they cannot afford it. So we would capture those seniors at 33% and then some. I think of those seniors between 33% and 47% as the marginal seniors. Yes, they can afford the dental care maybe if it's not terribly expensive, but it's tough for them to do that. So they're marginal. Now, the second thing that our policy does, and this is the policy that we're talking about in all the newspapers and all the media, is that it says we don't want to be a part of Part B. We want our own part. Much like the drug companies got Part D, we refer to it as Part T for teeth, right? And it probably wouldn't be that if we got to be Part E, because they would do things in alphabetical order. But we want members of Congress and their staff to remember it, and believe me, they do. They understand Part T. And why is that? Well, it would be geared specifically to the dental profession and how dentistry is paid for. And this would be so easy to do because it would be using the infrastructure that dentists are paid, dental practices are paid through right now. It's very simple to us. Focus on the low income because they're the ones that need it the most, and make the administration of the program as simple as possible. Now, I should also mention that individuals up to 300% of the federal poverty level, we actually capture a significant percentage of Hispanic seniors. So 67% of Hispanic seniors fall under 300% of the federal poverty level. 70% of Black seniors fall under the 300% of poverty level. So we actually would capture a significant number of seniors of color and ethnicity. Next slide, please. All right. So I have been with everybody I talk to on Capitol Hill, the media. This is pretty much the drumbeat that I keep pronouncing. And that is that if you got scarce federal resources and you want to get the most bang for your buck, you're going to treat those low-income seniors that don't have the money to go to a dentist, and that's who the ADA is focused on. And I have to tell you, it's hard to argue against that. It really is. And the other side, and there is another side, there's always another side to the story, says, well, that's not really the way Medicare is set up. And don't you think every senior deserves a benefit, even the very wealthy seniors? And our answer is no, because with scarce federal resources, where do you want to put that money? You really need to focus that money on the people that need the care the most. And you know what? If we did that, then those seniors would be living their lives hopefully pain-free. They would eat more nutritious meals, and they wouldn't end up showing in the emergency department of a hospital, where they would go to get relief for their pain. And in some cases, as I think many of you know, if the oral health problem that they have is severe enough, they get admitted to that hospital, and it ends up costing the system tens of thousands of dollars in medical costs. So there's actually savings that accompany our policy as well. Next slide. Okay, so these are just a few of the, we, I think, have such an interesting position that we're being picked up everywhere. And these are just a few of the outlets. I did 6 interviews today with different health policy newspapers and not newspapers, newsletters in Washington and CBS and a bunch of other folks today. It was a busy day because I think it's on the next slide. Because actually Bloomberg, which is pretty widely read, printed this article today, and I just took an excerpt of it that said the centrist Democrats. Now, I probably should have started this conversation off by saying, I think all of you probably know that the margins between Republicans and Democrats in both the House and Senate, I believe, have never been slimmer than they are right now. So the Senate is actually split 50-50. And if all the Democrats vote for this, they're still tied. So Vice President Harris would have to come in and break that tie. And the same thing is almost true in the House, where the margin is only 3 Democrats over Republicans. So if they got 3 Democrats to vote against the House Democrats, then that whatever that bill, that measure coming before the House would fail. So we actually have focused on the centrist Democrats in both the House and Senate, and this is what has happened as of today, that the centrist Democrats are saying to themselves, well, wait a minute, maybe we should, since we have scarce federal dollars. The ADA is right. If we have scarce federal dollars, let's focus it on low-income Americans. And Joe Manchin actually came out and said, I'm in favor of means testing all new programs. And Joe Manchin and Senator Sinema from Arizona are the 2 folks that, 2 senators you may have been reading most about, that are actually in line with our thinking. But we know this, we know there are actually a few more Democratic senators that believe what we've been saying. So we're actually picking up steam, and we're going against some pretty powerful groups in Washington, like AARP and a group called Families USA, and there are many, many others. But I think we've made an impression. The Republicans, you know what? You don't even need a Republican vote to pass this measure, this budget reconciliation bill. So they're kind of sitting on the sidelines. So it's the fights within the Democratic Party, and I think we've convinced the centrists. Think of it our way. Let's think of this differently. Next slide. Okay, so this is a busy slide, and I don't usually like busy slides, but I put it up here anyway. So while I'm talking, maybe you can read it. So it's the moderate Senate Democrats who ultimately are going to make the decision about how big this reconciliation bill, how big this reconciliation package is going to be. Now, by the way, I mean, it includes a whole bunch of healthcare proposals, but it also includes other provisions dealing with climate change, education, particularly free college, community college, daycare, and then just so many other issues. The package right now is $3.5 trillion, and I can't tell you, that's a huge number. But it's the moderate Senate Democrats who ultimately are going to be able to decide what that top line number is going to be, and I'm pretty sure it's not going to be 3.5 trillion. It's going to be probably a lot less than that, but we don't know yet. And then House Democrats are also going to have to determine their priorities. Once that number starts coming down from 3.5 trillion to whatever number it is, then you've got more programs than you've got money for. So Democrats in both the House and Senate, but particularly the House, because they're going to probably start this process off, are going to have to determine what those priorities are. The Senate Democrats are probably going to follow, and whatever those priorities end up being. And there are a whole lot, as I said, healthcare proposals, of which a Medicare dental benefit, a Medicare hearing benefit, and also vision benefit are just a few. So how can you do everything? Well, you really can't. So they've got some tough decisions to make. But we are going to continue to push our message because I think it makes tremendous sense. It's our policy, and it's actually starting to catch people's attention. Next slide. Okay, this is where I'm going to ask you for your help. You know, we've had so far 50,000 emails go to Capitol Hill from thousands and thousands of dentists just over the last 2 weeks. That's made a big difference because, you know, you're in a profession that is one of the most highly respected professions in this country. And so when a member of Congress and or their staff receives an email from a dentist or someone in the dental profession, they go, okay, I'm going to listen. And 50,000 emails is impactful. We're going to send out probably a couple more, at least, action alerts, as we call them, grassroots action alerts, and we need everybody to respond. It's critical that we get folks to respond. And we continue to have meetings up on the Hill, because as these letters come in and these emails, I'll call them emails because that's what they are, as these emails come in and my staff goes in and has these meetings with these members of Congress and the congressional staff, they usually say something, well, we've already received 50 or 100 or 200 emails from dentists back in our district or in our state, so we really need to understand why you all have a problem with this bill and what you want as a replacement. Next slide. So I'm asking you to get involved. I'm asking you to respond to those action alerts. And if you've got relationships with your members of Congress or their staff, you should feel free to pick up the phone and call and have a conversation. But stay in touch with us. Let us know about your relationships with those members of Congress. And actually, it's those relationships that make a big difference. I'll tell you that there's a dentist in West Virginia named Dr. Mike Medovic, and he's actually a board of trustee member for the ADA. And he actually, while I was sitting right next to him at a board of trustee meeting, he sent an email to Senator Manchin's wife, and he knows Senator Manchin's wife, and said, we need to talk to the senator about this dental benefit issue. 10 minutes later, we get a phone call from Lance West, who is Senator Manchin's chief of staff. Why is that? It's because Dr. Medovic has a personal relationship with the Manchins, Senator Manchin and his wife. And that's, I think, opened the door for us to have this conversation, and why Senator Manchin said just this afternoon, I am not voting for any Medicare expansion unless it's focused on serving low-income seniors. Now, where do you think he got that from? He got it from your profession. He got it from your profession, and being involved has made a difference. So I think that's the last slide. Can you just roll up to that? Let's see. Okay. So maybe we could open it up now for questions.
So I guess, you know, I have a question, and I've been sort of following this, and we did make a video kind of about it. And, you know, one of the big questions that I see being tossed around on social media and frankly, that I get asked is, you know, why does the new dentist or the student or the resident care? How does this impact the future of dentistry as related to all of us?
And that's a great question. If the bill that is right now before the House, if it got passed into law, it would not just change dentistry with respect to how seniors are receive their care, but it would also change how the dentist would be reimbursed. The government would decide how much you get reimbursed. And I can tell you from experience, with the Medicaid program, one of the big problems is the government decides they don't want to pay you for the work that you're doing. In other words, in many states, they do not reimburse the dentist enough to cover your costs. So you actually lose money on every Medicaid beneficiary. Not only that, but they make the administration of the program so cumbersome that sometimes is a bigger reason why dentists don't participate in the Medicaid program, because they have to file all these papers. And then in some states, the state says, you know what, we want to audit your practice because we see an irregularity. And so you have to go hire accountants and hire lawyers, and it costs tens of thousands of dollars to fight an audit. So why would you want to do that? Okay, hopefully, if they set up a Medicare dental program, it would be, if the way under our plan, it would be simple enough to run that we believe that wouldn't be a problem. It would be reimbursed differently because it would not be under Part B. Now, one of the problems, this is another problem, one of the problems that the physicians face is, and the vast majority of physicians take Medicare. Now, why do they do that? They actually have no choice. They actually have no choice. Because if they don't take Medicare and they see a senior in their practice, they have to have the senior agree that that senior will not file a Medicare claim. And if that senior, and that they are willing to pay out of pocket for that service, that medical service, and if they need a prescription, that it won't be reimbursed by Medicare. So most patients are saying, no, why not be it? Why aren't you a Medicare provider? So the Medicare system kind of forces everybody to get into Medicare, whether you like it or not. Not only that, but Medicare does pay less than commercial programs. But what happens in the commercial insurance programs, this happens on the medical side, and it would happen on the dental side. So let's say your fee for service is up here, okay? Patient walks in and they write you a check or hand you their debit card or credit card. You're getting paid, probably 100% of what you're charged. When you take commercial dental, I won't call it insurance, a commercial dental plan, because it's not really insurance, right? They actually reimburse less than fee for service, than walking in. But you're still making money. Medicare, because we're talking about 63 million senior citizens, they would pay less than the commercial. Well, the commercial plans aren't stupid. And what they end up saying is, well, if you're willing to take this lower rate to treat Medicare beneficiaries, then we're going to lower our reimbursement. And so across the board, your reimbursements would go down across the board. And what that ultimately may mean is that you have to work harder to make the same amount of money. Now, any of you still have student loans, or?
Well, actually, that brings up a great point, Mr. Graham. One of the questions that I wanted to ask from there is that the average dental student that graduated in 2020, so just a little over a year ago, the average is over $300,000 worth of debt. So if we're starting to reimburse dentists less and less and less, and like you said, you just have to work a little bit harder. But now you see, if you take it in medicine, because I work at the hospital every day, we see these procedures where it's a big procedure. A patient has to be put to sleep for something that wasn't necessary. The whole procedure wasn't actually necessary. We would see that more and more in dentistry. We'd have to see more patients. We'd have to do a lot more things to patients that they don't necessarily need. Is this necessarily making it more accessible, or is it making it like, I'm seeing like how are we going to pay off all the student debt with dentists, our highest professionals in the communities?
Yeah, Brendan, what you laid out, I hope doesn't happen, where dentists are recommending unnecessary care, or maybe more care than needs to be done, or maybe a more inexpensive treatment plan could be worked out. But when you've got lots of debt, I get that, and that actually, all of this puts you, the dentist, in a horrible position. So we're trying to prevent all that from happening. What we're looking for is the win-win, and the ADA's policy, I think, is that win-win. So let me go back to, there's 63 million senior citizens. 1/3 of them do not go to the dentist. They do not walk through the door of a dental office. That's 21 million senior citizens. If we focused on giving them a dental benefit that reimbursed the dentist appropriately, and let's say that's somewhere in the neighborhood of the commercial plan, okay? then that actually brings more business in to your office, so that it takes care of what we refer to at the ADA as your busyness problem, not business problem, takes care of your busyness problem. So you're going to have more patients. Your chair is not going to go cold. These seniors who haven't seen a dentist in years are going to get treated. They're not going to go into the emergency department of a hospital to get relief from their pain. You're going to be able to treat them. You're going to get reimbursed. You're going to make a profit, and you're not going to get rich on this, but they will help pay your bills. And so if you need to increase your volume, you'll be able to do that. And it's great for the patients. It's great for the dentist. It's the win-win. And that's what we're focused on.
All right, so Dr. or Mr. Graham, so we've talked a lot about how
Just Mr. or Mike.
whatever you want to be called.
Mike is good.
All right, Mike. So we've talked about how dentists and, those associated with the ADA have been fighting for dental coverage to be part of Medicare. How do you think undergraduates or pre-dents, those that aren't in dental school, can do to show up and, support this cause if they do, instead of just or in addition to volunteering at free dental clinics like Mission of Mercy? What can we do?
Okay, I want you to ask the question again to make sure, because I thought I heard two questions in there.
So how there's dental clinics, free dental clinics that you can support and volunteer at just to show support. How can we as undergraduates or pre-dents do to help this legislation go through? Is there anything that we can do?
Well, in fact, the last slide I had up, I think it had the advocacy site. Oh, the dogs are awake. Has the advocacy site that you can go up on, and I ask that you can send an email to your member of Congress. We need you to do that. I would go up on ada.org, and I'm apologizing ahead of time because ada.org is going through a transition where it's going to be really good. But go to ada.org/advocacy, and you'll be reading almost every day the new stuff that's to keep you up to date on what's happening. But the best thing I can ask you to do is to keep sending stuff up to your members of Congress, letting them know that the ADA has a better way of doing this. And you know what, I probably should say this too, and it sounds, it's unfortunate during these times. I've worked on Capitol Hill since, as I said, 1979. I remember the times when Republicans and Democrats would sit down and have dinner together, and they might go out for a drink. And at the end of the day, they may disagree during the day, but then they were friends at night. We don't see that as much now. We've got to get back to that. But unfortunately, the Medicare dental benefit is a political football. And why is that? Well, there are some up on Capitol Hill who believe that there should be a single payer system for all medical, and you can do it through Medicare. And Bernie Sanders is one of those people. And I don't mean to offend anybody, but that's what Bernie Sanders wants. And he wants a Medicare dental benefit for all seniors as another step toward this Medicare single payer system. And now Chuck Schumer, who is the majority leader of the Senate, and actually the ADA enjoys a very good relationship with Senator Schumer. He's really a terrific guy, but he's not stupid. Senator Schumer knows that there are 63 million seniors, all of voting age, by the way, of course, by definition, who if he can say to them, and by the way, seniors traditionally vote more Republican than Democrat. And he wants to be able to say to them, hey, you remember it was the Democrats that got you this Medicare dental hearing and vision benefit. So vote for us in 2022, 2024. So there's a lot of politics involved in this. So that's the reason why we have to be involved in the political process. And if we're not, Congress is going to do what they want, and it's going to impact your lives tremendously.
Would there be a way for this bill to pass where they match the commercial reimbursement that you had mentioned previously?
So when a bill passes, Traditionally, they don't go into that detail. HHS makes that determination, but we lobby HHS all the time. We go in, we have meetings with them to determine, if you set the dental benefit at this low, no dentists are going to participate. So your provider network is going to be non-existent. And who do you think is going to be blamed for that? Well, the government will. So you don't want to do that. You want to have a reimbursement level high enough to create a robust network of providers. And usually that's at what we call the 50th percentile. It's a reimbursement rate where 50% of the dentists in the country would accept that rate, which actually is very close to the commercial rate. Other questions?
Do some of these programs actually have any almost, I don't want to call it reward, but do they reward dentists that participate in this program? Say they are $300,000 in debt. Is there a reward system in place to allow them to kind of pay off this debt? Because if you're seeing Medicaid patients all day, even if you're running the mill, you're not really going to be able to pay off $300,000 in debt, in a reasonable amount of time. So maybe you'll be able to pay the bills, but you're not really living up to the means that you probably should be at that point. I'm just curious.
There's been no talk of that, but the government has historically tried to get various healthcare providers, including dentists, into those underserved areas through some type of loan repayment program. Public Health Service does that. That's actually a very good idea, that maybe dentists that see a certain percentage of seniors would get kind of a bonus for treating those seniors. We've actually floated that idea on Capitol Hill with regard to the Medicaid program. It didn't go anywhere, but there are a number of states that actually have done that. And so dentists that move into underserved areas, I think Ohio, Florida, maybe a few other states, I can't remember. When they move into that underserved area, they actually get money from the state for moving into that underserved area. So what's the loan payment on $300,000? What, $2,000 a month, or is it more than that? 3,000?
I'm not.
Depends on the terms, I guess, how many years you have it out and what percentage is your interest rate. But
it does. Most percentages as of 6 years ago were between 6 and 7%, and they started accruing immediately. Yeah. There was one started accruing immediately. The other one started after you graduate, even when you're in residency. So it's not doing any help to the dentist. I think, you said you floated a buy and it didn't go anywhere. That would be a tremendous part to advocate for dentists, because if you are able to, it's not that the burden isn't on treating underserved communities. That's not the burden. If I could give my standpoint from a dental student and young dentist, the burden is the debt, right? Because no one needs to live in the 10-bedroom mansion. No, we got to get the debt paid off. Everyone would be fine with working in the underserved communities for whatever that is. If it matches Medicaid or a little higher, that's fine. But if there's a reward system in place, just like you said, you see a percentage of patients in that community, a certain number of hours a week that rewards the young dentists, say with 300,000, they'd be willing to work there a bit more.
Let me think about that. That's an interesting idea. I mean, we've replicated that in Medicaid. So we've been kind of focused on making sure that they accept our policy, but I like that idea. Thanks, Brendan.
Yeah, that's what we're doing here. Then you don't necessarily have to pay the dentist more, right? But it helps them out. And it helps.
Well, it doesn't incentivize the dentist to treat the population that needs this care. I mean, when I say there's 21 million seniors who don't go to the dentist at all, I mean, think of all the care that they're going to need when and if they get a dental benefit. So that's a good idea.
If anyone wants to kind of reach out to you and has any specific questions, how do they do that? What's the best way to get?
Usually I'm really good about this, and I put it on my slide and I didn't do it. I'm going to give you my cell phone number. And it's 202-309-2046. Now, my colleagues always tell me, are you out of your mind? What are you giving? You're giving hundreds of people your cell phone number. I like getting the calls, folks. So I actually learn as much, I think, as I can dispense to the caller, because I get to learn that perspective. So, but not enough people call me. So if you have questions tomorrow after thinking about this, or you want to help get more of your colleagues involved, because that's going to help us win the day on this. It's the reason why I wanted to talk to you, because if you're interested enough to be on this call late at night, then maybe you'll reach out to 10 or 20, or use your social network of friends to say, get online, go on ada.org/advocacy and send in that grassroots action alert. During COVID, we sent out 4 action alerts. We had an average of 150,000 emails going into Capitol Hill. I had members of Congress calling me and saying, Mike, please tell your dentist, we got the message. Tell them to stop emailing me. So naturally, of course, I said, keep emailing, because we got everything the dentist needed to get through COVID, everything. And we've got to do it again.
Right. And for, the people that don't know, kind of all of the provisions, the CARES Act, the PPP, the repayments, all of the provider relief funds, these things all came from action alerts that the ADA sent out and the overwhelming response from dentists around the country. So, that's kind of what we need here. We obviously know that we have the numbers and we need everyone to kind of rise up and respond. Mike is super, super responsive. I called him, I was in Greece and he picked up. But you know what, this is kind of what's needed. And so I think one of the biggest takeaways and things that I've sort of learned, especially sort of from social media and from interacting with the students and residents and new dentists, is how does this impact you in the future? And I think we got a really good kind of example from this firsthand with the person who does this every day in and day out with legislators and dentists alike. So thank you so much for giving us all of that information. And you will probably get phone calls. So thank you for the phone.
Well, actually, one of the board members turned to me at the last board meeting I was at, I guess a week or so ago, and said, I'm selling my practice. This is not going to impact me. But I think of the new dentist. I think of the dental student. It's really going to impact them. This is your future. If we don't get involved in this now, if we don't make a change, because we're fighting a lot of forces out there that want to do this, I think, for the wrong reasons, for the political reasons. If we don't do this, then we're going to be faced with this for many, many, many years to come. And just like you said, Brendan, I mean, you've got bills to pay. You deserve to be reimbursed appropriately. They're working, I'll use this analogy, they're working on this transportation bill. So there's a reconciliation bill and there's this transportation bill that they're working on. If that transportation bill passed, there would be about $1 trillion that would go out to the states, and the states would then contract with road construction companies and bridge building and repairing companies. Do you think they're going to reimburse those road construction companies and bridge companies less than the cost for them to fix those roads, to fix those bridges? Of course not. If they're going to make money. They're not going to make a tremendous amount of money, but they're going to make money. Well, why should the dentist be any different? Why should you lose money if in a sense the government is going to pay you to treat senior citizens? That's a contract. They shouldn't reimburse you less than the cost of doing business. So it's not fair, and I hope you'll join me in this quest. The good news is that our position makes a lot of sense, and it makes sense, makes dollars and cents, and it makes sense that you want to provide care to those that need it the most. I don't need a dental benefit. I'm eligible for Medicare next year. My 91-year-old mother, I bring her to the dentist. Guess what? She hands her debit card. She's not wealthy, but she pays her own, and she's happy to do it. So some people don't need it and others desperately need it. So anyway, I guess that's it. And thank you so much, and keep reading ADA.org/advocacy to find out what we're up to. And please, please, please tell your friends. Thanks
Thank
so
you
much.
so much, Mr. Graham. Thank you for joining us today. I really hope we can continue this in a way, partnership with the ADA, because we have roughly 200,000 followers on Instagram that we'd like to get the message out to. They need to hear it. And, you know, the future dentists in this community, in this world, in the United States, we need to make it, it's got to be a brighter future. And it will be for the patients, in effect.
Absolutely. Yes. And by the way, you don't have to be a dentist or a dental student to send an email into your member of Congress saying, you know, don't support the bill that's before the House now, support the ADA alternative. You don't need to. So you can tell your friends and family who are not in the dental world, hey, do me a favor, send an email, and it counts just as much. All righty. Thanks, everybody. Have a great evening.